The Biden administration is proposing a new rule that would give millions of Americans with obesity access to weight loss drugs. Right now, Medicare only covers these drugs for people diagnosed with diabetes or cardiovascular disease who are obese or overweight. Some state programs cover the drugs, but if not, they can cost someone as much as $1,000 a month. Under the new rule, Medicare or Medicaid would cover these expensive medications like Ozempic and Wegovy. Doing this could cost taxpayers as much as $35 billion over the next decade. But President-elect Trump's pick to lead the Department of Health and Human Services, RFK Jr., is an outspoken opponent of these drugs. So let's dive into all this. CBS News reporter Alexander Tin joins us now. Alexander, thanks for being here. What's the Biden administration's reasoning for proposing this change now, and how much of a game changer would this be?
Yeah, I mean, this would be a significant change, one that advocacy groups and lawmakers have been calling on the Biden administration to make. From the big picture, what the Biden administration says is that the reason they're doing this change now is because doctors' groups are increasingly recognizing obesity as a disease that should be treated as a disease, not just a symptom or a characteristic. And second, that the prevalence of obesity in this country is going up. Of course, that doesn't answer the more micro question of why at this point in the calendar year they're rolling out this proposal when everyone knows now that the proposal will be finalized by their successors, the Trump administration. We don't have a great answer for that, except from what officials have said today, which is we made this decision now because we made this decision now.
And it would be very expensive, so that certainly is a component to consider for the American taxpayer. But what can you tell us about the benefits of these drugs and really why we keep hearing so much more about them?
Yeah, I mean, obviously, there are the narrow set of benefits that first got the FDA's approval for these drugs, which is the significant ability not only to create weight loss, but sustain weight loss. Of course, what has been tacked on after that is all these additional indications, as doctors say, for all the different benefits that they could have for cardiovascular disease, for sleep apnea. We're increasingly hearing about the possibility this could get FDA approved for treatment of addiction. But of course, all of those additional indications, putting that aside, already was covering 75% of Medicare beneficiaries. The remaining 25% with none of those other conditions, that's what this proposal is targeting now, extending this coverage.
What has RFK Jr. said about these drugs, and could he shut the proposal down if he's confirmed?
Yeah, I mean, it's definitely within his authority to control how this rule will be implemented, if at all, once he is confirmed, if he is confirmed by the Senate. In the past, he's been critical of drugs like Ozempic and Wegovy, as well as the drug makers behind them. But we've also heard from Kennedy, him say that he would be open to covering these through Medicare and Medicaid. Of course, his caveat is that he also thinks other things like gym memberships, healthy food should also be covered by Medicare and Medicaid, just like Ozempic and Wegovy.
Right. I mean, for a lot of people, diet and exercise is simply not enough. Maybe it's something with their genetics. I mean, I'm not a doctor, but I know that for a lot of people, these drugs are literally lifesavers for them. But we'll have to see what happens to this new rule. Alexander Tin, thank you.
Thank you.